Prynhawn da a chroeso I chi. Good afternoon and welcome. We're so pleased to be able to host this event this afternoon on behalf of the STEM Gogledd project. Da ni'n falch iawn o allu cynnal y sesiwn yma ar ran cynllun STEM Gogledd. Mae STEM Gogledd yn gynllun sy'n gweithio yn benna yn Conwy, Gwynedd a Môn i gefnogi pobl ifanc o oedran ysgol uwchradd i gymryd diddordeb mewn STEM ac hefyd i cynnal nhw ac i'w cefnogi nhw i fynd ymlaen i astudio ac i weithio ym meysydd STEM. STEM Gogledd is a project working in Conwy, Anglesey and Gwynedd predominantly, and our aim really is to enthuse, to encourage, to support young people of secondary school age to take an active interest in STEM and related occupations, and hopefully see them go on to study further and to end up working in the STEM sector. So we are fortunate for this session this afternoon that we have Dr. Heidi Phillips, who is Associate Professor of Primary Care at Swansea University Medical School. And Heidi's going to share some tips really on those of you interested in potentially applying for medicine. I know I don't want to steal her thunder, but she's going to be maybe using some examples of some personal statements and her experience. There is an opportunity for you to ask questions. There is a Q&A box. Please do ask questions. We can't promise that we'll answer everyone today, but hopefully we will be able to capture all the questions, so there may be an opportunity for us as STEM Gogledd to come back to you at a later date with that. Da ni'n falch iawn o gael Dr. Heidi Phillips yn athro cysylltiol ar gyfer gofal sylfaenol yn ysgol feddygol Prifysgol Abertawe. Mae Heidi, da ni'n ffodus iawn o'i chael hefo ni i rannu i phrofiadau hi o dderbyn myfyrwyr i fewn i'r brifysgol, a gobeithio rhoi chydig o dips i chi ar be mae'r prifysgolion yn ddisgwyl, ac hefyd sut i obeithio i wneud cais llwyddiannus. Then we shall move on. I'm going to introduce Heidi and let Heidi say hello to begin with, and I know Heidi's going to move and show you a presentation which you'll be able to see on screen. So Annie, yn fan hyn, da ni'n mynd i gyflwyno Heidi chi. Welcome, Heidi.
Diolch, David. Dwi wedi bod yn dysgu siarad Cymraeg am byti 3 mis nawr, ond mae dal eisiau fi ymarfer. I think I got that right. My name's Heidi. I've been trying to learn Welsh for about 3 months, but that's the only Welsh you're going to get out of me, so apologies for that. The rest of this is going to be in English. So I'm going to share my screen with you, and hopefully we'll get ahead and be able to, hopefully you can all see that. That's why we're here. If you've joined a link by mistake and you're expecting to have your Tesco's order online, you can leave now. This is a presentation about hints and tips to get into medical school. So I'm going to just start by saying who I am. So my name's Heidi. I'm a GP. I wasn't always a GP. I was an anaesthetist first, but I became a GP because I'm interested in people first and foremost. General practice allows me to do loads of things. So it's not just about going into being a doctor and going into medicine. There are so many branches of medicine that there's something for everyone. I teach in the medical school in Swansea. I was the director of admissions for medicine until a couple of years ago, so I'm very familiar with what it takes and what we're looking for to get into medical school. And I also sit on the Medical School Council Selection Alliance, which is the organisation responsible for giving advice to medical schools about medical school selection. I've got special interest in ADHD and autism, and I work in the neurodevelopmental team in Swansea. And I'm also a mum to 4 children. We have a small holding. We keep chickens, we keep sheep, we keep occasionally pigs. So there's lots of things you can do, and you can still have a work-life balance if you become a doctor. Okay, so why? Why are we here, and what are you hoping that we're going to get from this session? So the first thing you've really got to ask yourself is, why do you want to study medicine? Why do you want to be a doctor? Okay, so what? You're interested in science. This is all about STEM. Well, close your ears, David. I wasn't that great at science, and I'm still a doctor. I really had to work hard at science to get to be a doctor. People was my thing. Okay, so what? You're fascinated with working with people and you want to help people? Well, you can do that by becoming a nurse or a paramedic or a shop assistant. So to be able to answer the question, why medicine, you really need to understand what medicine is and what being a doctor is. And it's really important that you think about that. You understand your own reasons for why you want to study medicine. And they're going to be different reasons to other people. There's no right or wrong answer. It's just important you make sure you have one, because it's a very good interview question. It's a very good starter interview question. The other reason for this slide, why, is because it's a fundamental question that you should be asking yourselves now and for the rest of your career. Don't take anything at face value. Constantly reflect. Ask questions, be curious. Reflection is an absolute key to becoming a doctor. It's not just describing something, it's reflecting on it, understanding it. I'll be coming back to reflection a bit later on, but it's important that we go back over experiences, we think about them, we talk about them, and we always ask why. Okay, so how? The rest of this talk is really about how to go work towards applying to medical school and what you need to do. Now, when I was asked to do this, I was told that the audience ranged from year 9 right the way through to sort of year 13, and there may be 1 or 2 older ones as well. So forgive me if this is a little bit teaching you to suck eggs and you're past this, but it is worth going through it because there's some good information here too, I hope. Homework, good routine, really important. Getting into this early so that you're working consistently. You don't cram everything into the last minute. Understanding what revision is and being able to revise is really important, because being able to condense a whole lot of stuff that your teachers tell you into what's actually important to learn is what it's all about. There's a huge amount of information out there. We can't, any of us, know it all. So understanding where to find that information, how to read it, how to make notes on it, that's what's key. Spending hours writing out your notes or colouring in pretty revision sheets is not the answer. Doing past paper questions is. Choosing your GCSEs is also really important. You choose GCSEs that you are good at and that you like. For those of you who are applying to medicine from school, you need chemistry and at least 1 other science, maths, biology or physics, but it's important that you get 8 good grades. So taking 13, 14 GCSEs, well done you, but it's not going to make you any more likely to get in than someone who's got 8 good GCSEs. And the fast that you need 8 A stars, that's not true. Swansea University Medical School has got a number of doctors, has produced some fantastic doctors that didn't get any A stars. If you want to do it, persevere, keep aiming for it. And hobbies, why are hobbies important? because you need to know how to relax, and it shows that you're a well-rounded individual. You don't need an activity every night of the week. You don't need grade 8 violin to be captain of the hockey team or head girl. You do need time out. You do need to be able to show that you have a work-life balance and that you can know how to wind down and look after yourself. And Snapchat and Instagram don't count. Okay, into year 10. What are medical schools looking for? Well, we're looking for students who can demonstrate they've got transferable skills. In other words, show what they're currently doing, what they're currently learning about and experiencing can be translated into what we're looking for when it comes to being a doctor. So how can you start doing this? Well, start by reflecting. There's that word again. Reflect on what you've done. Practice. Listen to yourself talking out loud. Pick one thing you've done or seen each day and discuss it in detail. What happened? Why did it happen? What should have happened? Could it have happened any other way? What could you have done differently? Reflecting is a key to being able to talk about things in an interview. But more importantly, reflecting in medicine is how we go over what's happened, if we've made mistakes, if we've learned things, to be able to understand what's happened, to avoid making or repeating mistakes that might be dangerous to our patients. Be curious, ask lots of questions, and read about what's happening in the world and where medicine's involved. COVID is an absolute classic. What did you do during COVID? During the lockdown? That would be an interview question that I would be thinking would be pertinent. What do you understand about what's happening with vaccinations now? What are the dilemmas facing public health? Things that are happening in the world today make for really good interview questions. And keep up with the schoolwork. Okay, so year 11. While all medical schools want at least 3 A levels, I say at least because some students head for 4, 5, 6 A levels. Medical schools want 3. But they're not all the same when it comes to which subjects. Okay, some want biology and chemistry, but some will accept either biology or chemistry as long as you have another science and a third subject. For some medical schools, a 3rd A level can be anything you like, but others prefer certain subjects. Some medical schools won't accept critical thinking or general studies or Welsh back. Some may not accept certain subject combinations. It's important, if you're applying straight from school, that you do your research and you pick the science subjects that medical schools are looking for, but also what you're likely to do best in. Work experience, well, that is an absolute classic. That's the one that causes the most hang-ups in applicants to medical school. And it is important that you realise it is not the what, but it is the how you reflect on that. Okay, so from year 11, it's basically you just starting thinking about it. So perhaps volunteering with Cubs or Brownies, or picking up a job like lawn mowing or dog walking for an elderly neighbour. And that's where you consider whether you actually like helping people. Things like care homes, support groups, clubs for children with disabilities, play schemes, children's sports coaching, tutoring younger students, working as a student mentor. Those kind of things are the things that you can talk about then in an interview. Year 12, as we've already started talking about, not all medical schools and courses are the same. Which medical school? Do you want to intercalate? An intercalated degree, an undergraduate medical degree, in other words, one you go straight to from school, is usually 5 years before you then qualify to become a doctor. But you can take a year in the middle of that where you do an extra year and you get another degree. So for example, halfway through my medical school, I took a year out and I did an anaesthetics and physiology degree. So you can come out of medical school with 2 degrees instead of 1. But there's other things to think about. How close to home do you want to be? For me, growing up in Swansea, I went to Cardiff Medical School. But for other people, they want to get as far away as possible. So you really need to think about what you want. Do you want a medical school that values both science and people equally, or one that's more focused on developing you as a researcher? So, for example, Imperial has a reputation for being very, very hot on science and research, whereas Swansea and Aberdeen or St Andrews are more about developing holistic practitioners and more people-focused. You need to go onto the various websites, read about the courses, and if you can, go on open days. Can you actually imagine what living there for 5 years of your life is going to be like? Can you imagine being there? If you're used to being by the sea, then you're not going to want to apply to a London medical school. Remember, it's not just about the course, but it's also about whether you're going to be able to get in. Look at their entry requirements, what grades they want, and whether you can face living there. And those words again, work experience. It's not all about work experience in hospitals, although if you can get it, it's valuable. You need to think about applying at the start of year 12, ring your local hospital to ask for information and apply early. You could contact your local GPs and ask. You need to put yourself out there and give it a go. What's the worst thing that can happen? They say no. But it's important that you realise it's not all about work experience in a hospital or with a GP. Okay, experience in a nursing home, in a care home, working with disabled or underprivileged children. It's all valuable. It isn't what you've done. It's about what you've learnt from what you've done, about what you've seen, but more importantly, what you've learnt about yourself. When we come to talking about interviews, I'll give you an example. Okay, the dreaded personal statement. What are admissions directors looking for when they read personal statements? Well, to be honest, most medical schools don't score personal statements anymore. As part of the Medical Schools Selection Alliance, universities were strongly discouraged from scoring personal statements and using them as the basis for bringing people to interview. Why? Because if mum or dad's a doctor or you've got somebody who can help you write your personal statement, you're given an advantage. And I, for one, think that's not fair. But that doesn't mean you can just dash off some generic personal statement that nobody's going to read. You need to take time and you need to go back to it. It's not something you can write in a day. Save it, read it, cut and paste it, adjust it, get other people to read it. It's your chance to show what makes you you. And it's also, for some medical schools, it gives them something to talk to you about if you have that kind of interview. I have seen and read hundreds of personal statements, and everyone gets paralysed with what on earth to write, what to say, and how to say it. So let's think about where you're going to start. The first place to start is, what do you think are the attributes of a doctor? What skills do you think a doctor needs to have? Okay, so maybe take a couple of minutes and think about that. Think about a doctor you know, how you'd like a doctor to be when you see them, and then you'll have a good idea whether that's the kind of doctor you'd like to be. So perhaps have a go in the chat and maybe write down some of those skills as to what you think a doctor needs to have. Nobody can see what you write, but it would be good to see at the end if anybody's actually thought about that. Okay. So I've written some attributes. They may not be the same ones as you're thinking about. That doesn't make yours wrong. It's just what I've been thinking about. Probably the number one for me is communication skills. Okay, knowledge is important, and being able to learn all the stuff you need to learn for medicine, yeah, it's important, but you know, more and more and more, it's not about what you know, but do you know how to get it? With the internet, we've all got access to knowledge. So for me, it's not just about knowledge, it's about communication. What's the point of having all that knowledge if you can't communicate it in a way that can be understood by patients? And maybe you're going to be the kind of doctor that thinks, well, yeah, but I'm more of a scientist. I don't want to see patients. How are you going to communicate your scientific findings? Communication, communication, communication. It's what we look for in personal statements. It's what we look for in interviews. Okay. Empathy. Being able to understand what it's like from the other person's point of view. Being able to stand a day in their shoes. Imagine what it must be like to be them. Caring. Work experience we've mentioned, but also teamwork and leadership. No man's an island, everybody works as part of a team. And medicine is not hierarchical. We have nurse specialists, we have physician associates, we have doctors, we have healthcare scientists, we all need to work together. So being part of a team is really important, but also knowing when to step up and when you have to take the ultimate responsibility. And then resilience, bounce back ability. Medicine's hard. People die. You need to be able to bounce back. You need to be able to cope with that, and you need to be able to move on and learn from it. I guess, and passion, not on the slide, but passion, enthusiasm. I want this. I really want this. That needs to come across. Okay, so you've written down your list of what you think a doctor needs to have. The next thing on your personal statement is to think about what skills you have, what you've done or what you're doing that demonstrates those skills. You see, you might want to start with listing everything you do. You might sort of think, okay, grade 5 piano head, girl, prefect, etc. You might be in a team, you might be a captain, you might be a library monitor, you might be in a club. You could list all the things that you do that you'd like to include, but it's not all about listing. Okay, it's about then thinking about those headings on the previous slide and linking where your experience and what you've got, where you think it can fit in. You've also got to think about an introduction. Most personal statements that I've read start with why you want to be a doctor. And these are your reasons. These are personal to you. Okay, so what we can do is share with you at the end. I have permission to share a couple of personal statements for students who were successful in getting into medical school this year. So you can see there's a theme with them. But here's one. I'm keen to pursue a career in medicine because it combines my aptitude for chemistry and biology with my desire to make a difference in the lives of people. Okay. Another, the General Medical Council describes the attributes of a doctor in good medical practice as not only possessing the required knowledge, but being able to apply that knowledge in partnership with patients and putting patients at the centre of their healthcare. And for me, this is what cemented my desire to become a doctor. And finally, something a bit different. Born at 29 weeks, weighing 1.4 kilograms, I survived because of a team of dedicated healthcare professionals. Whether this has impacted my desire to work with and for the benefit of others, I can only surmise, but the human body and its intricacies have always fascinated me. A career in medicine would allow me to improve my scientific knowledge and skills and to make a difference in other people's lives, allowing me to give something back to the NHS. So all very different reasons, and you'll have your own, but that's an introduction as to where to start. And then you're going to start talking about what you see the attributes of a doctor as being and how you think you fill them with the experience you've had, with what you've read. And then your summary at the end. To finish, generally, most personal statements have what you do to relax. In my free time, I manage my work-life balance. In order to maintain a healthy work-life balance, the importance of being able to relax and make sure I maintain my own health at the end of the day. Okay, so hopefully that helps with the personal statement side of things. The next bit is the admission test. So you think you've done it when you've got your A-levels. Unfortunately, for many medical schools, there's more. And there are different types of admissions tests that you need to take in order to then apply to medicine. And you need to look on the websites for the medical schools to see which admissions tests they ask for. The UCAT is the University Clinical Aptitude Test. It can be booked from May the 1st, I think, and perhaps you can book a date after your AS or your mock exams to give yourself some time to prepare. There's loads of practice papers available on the website. It's a 2-hour computer-based test which assesses a range of mental abilities that medical schools think are important. There's 5 sort of little sub-tests: verbal reasoning, numerical reasoning, abstract reasoning, decision-making, and situational judgment. Different medical schools weight them differently. For some, it's just about passing the UCAT. It's not necessarily how well you do in it. For others, they'll take the top performers. So it's important that you read the websites and you understand how they're used. The biomedical admissions test is in early November. Early entry in September is available, but you probably haven't got enough time to prepare. And that's a 2-hour computer-based test, and it tests your ability to apply your scientific and mathematical knowledge, as well as problem solving, critical thinking, and written communication skills. And then the GAMSAT. That's the Graduate Australian Medical School Admissions Test. And the graduate schools, like Swansea, like St Andrews, that's the one we use. And that's a 5.5-hour exam. It looks at 3 areas: reasoning in humanities and social sciences, written communication, and reasoning in biological and physical sciences. So very different tests, worthwhile having a read and understanding, deciding which might be the right test for you, and also which medical schools take which tests. Okay, so if you've made it as far as here, well done, you've been invited to interview. And if you're still awake, this is important to know that there are different types of interviews. And it's really important that, again, you do your research, you read the websites to understand the type of interview that the medical school you've chosen is going to be running. So a panel interview is a very traditional type of interview. It's still run by several of the selected medical schools. And that's where you face a panel of interviewers and you get asked questions from each one in turn. MMIs are multiple mini interviews, and they're becoming far more popular. Approximately 60% of medical schools now use multiple mini interviews, and that might be increasing. And these are essentially between 8 and 15 stations that each of you will rotate around one after the other until you've completed them all. And each station usually has one interviewer or assessor, and they'll require you to do something, or they'll ask you a question or a series of questions. Each station is strictly timed, is usually between about 5 and 8 minutes long. And then a selection centre is often a cross between a panel interview and an MMI, and takes the best of both, but often brings in other things as well other than questions. So it might give you some teamwork skills, or it might give you some practical skills, or some numerical skills. There are pros and cons to all of these. Research that I conducted a few years ago shows students are pretty much 50-50 split as to whether they prefer one or the other of panel or MMIs. Panel interview allows you to develop a rapport with your interviewers, to have a more in-depth conversation, the opportunity to really sell yourself, and allows you to ask any questions from the medical school. On the flip side, if you mess up one of the questions, they've all seen it, and you've got to kind of get through the rest. MMIs are like individual interviews. You can afford to mess up on one and potentially make up for it on another. The students I asked thought there was probably less bias with MMIs, and that interviewers didn't influence each other when it came to scoring them. But they also felt they didn't have as much opportunity to sell themselves. So as you'll see, and as you've heard, I've said MMIs between 5 and 8 minutes. So when I've ever done mock interviews with students, without exception, every single student that I've offered a mock interview to, I've said, okay, so for example, why do you want to be a doctor? And then I've timed them, and they managed to talk for about a minute. That's 4 minutes of silence. You need to be able to practice talking for between 5 and 8 minutes on a subject. Another example was a student who I said, so tell me about your work experience. And he said, well, I did my work experience in an operating theatre. I was able to shadow a surgeon, and I was lucky enough to go into the theatre. So I said, so can you tell me about what you thought about that? And he said, well, it was fascinating. I thought it would be much scarier than it actually was. And I was amazed by how friendly everybody was. That was it. So 30 seconds describing his experience in theatre. By the time we'd finished, his response was this. When I went into the operating theatre, I was amazed by how many people were in there. That was the first thing that struck me. And I've always had a preconception that the surgeon is kind of the head of the team, the most important person. But I think what really struck me was how everybody has a role, everybody has a defined role, and everybody relies on each other. So the person standing alongside the surgeon could have probably done that operation themselves. They could predict what the surgeon wanted. They could offer the instruments that were needed with barely any communication between them. The anaesthetist, who was at the head of the table, who was keeping that patient alive while the surgeon operated, had their own role to do and was very involved with what was happening on the table so that they could adjust the anaesthetic. And then at the end, when the whole operation theatre went completely quiet, for one of the nurses to count the swabs at the end. And that role was so vital. So I think what really struck me about my work experience was the importance of teamwork. Do you see the difference between describing and reflecting? And that's what they're looking for in interviews. Okay. So what type of questions might you have? They might ask you to do a role play. So they might give you a little piece of paper that says there's a nervous man in the waiting room and you've got to go and chat with him and reassure him. They may ask you to have a chat with a university student about a headache and the painkillers they're taking. You might get asked, what would you do type questions. For example, You've administered the wrong antibiotic and the patient's had an allergic reaction. What are you going to do? Or you're a waitress and you've got X, Y, Z to do. How are you going to prioritize? How are you going to manage your time? Sometimes there are picture questions you might get asked to describe. So what's going on in the picture? So first of all, you need to be able to describe it, but then they might ask you, well, how might practicing medicine in those two pictures be different? So they might show you a rural versus an urban scene and ask you to talk about the different challenges. They might ask you to talk about the difference between prevention and treatment. You may be asked how you deal with a mistake or what you do when something goes wrong. So imagine you were asked to look after your friend's pet and it died, and you've got to tell your friend what happened. You might get questions about teamwork, the importance of a team, the qualities of a good team, what you'd bring to the team, the qualities of a team leader. They might ask you, have you seen any good leadership or poor leadership? And the ethical questions, pros and cons questions. Almost every interview will have an ethical question. And that's where there's no right or wrong answer, but lots of shades of grey. So pros and cons of genetic testing, or patient smokes, but they need an operation that can't be done if they continue to smoke and the patient refuses to quit, or patients wanting to consider euthanasia when life gets too hard and their pain gets too great. Where do you stand on that? So you need to be able to structure an answer. You need to be able to listen to a question, pause, and not jump straight in with an answer, but think about, okay, this is an ethical question, and therefore there's probably two sides to this question. On the one hand, X, on the other hand, Y. And in summary, I think on balance, this is where I stand, this is how I feel. Some medical schools will ask you simple numeracy questions to make sure your maths is good enough to be able to do simple drug calculations. So if I was you now, I think I'd look up on Google practice interview questions for medical schools and then start talking it out loud. See the question, speak your answer. Get family, friends, boyfriends, girlfriends, siblings to ask you the questions so you get used to hearing your own voice answering. Practice structuring your answer and make sure you can talk about something for 5 minutes. Okay, so finally, where are you going to go next? Loads of resources on the web. Google is a mine of information for questions. If I was going to look, I'd look at the websites that I'm going to show you, as well as the medical schools themselves. Some medical schools offer open days and taster days and other opportunities for certain students. Some offer lower entrance grades for specific characteristics. So for those in care or for those of you on free school meals, they often have lower entrance requirements. So it's worth looking, doing your research, doing your homework. So we will share these slides with you, but the Medical Schools Council, the Royal College of GPs, GP schools in North Wales have a website that's a fantastic resource. Looking at UCAS, the British Medical Association, and then these are the tests, UCAT, BMAT, and GAMSAT. So I think I can stop sharing my screen. I hope. I'm not sure how to do that. That's ending my live event, and I don't want to do that. Right, I think I've stopped sharing my screen. So that's it from the perspective of what I was going to talk to you about. So I guess from here we've got, do you have any questions, anything at all that you'd like to ask? And I think David is going to come in and put those questions to me if you've got anything at all. Remember, there's no such thing as a stupid question.
Thanks very much, Heidi. That was really, really informative. And even though, am I too old to? Yes, I'm far too old to train to become a doctor. But if I was of an age where I was thinking about applying, and I think, you know, that some of the points that you've made are going to be really useful in terms of, and I do forgive you for starting off saying that you're not good at science, because not everybody is, but obviously lots of the attributes that you've mentioned following that about, you know, being curious, reflecting, and I think that's one the one word I'll probably take away and maybe apply it more in my, even though my role isn't in medicine, but you know, to reflect more and understand more. So really, really, really useful. So some of the comments we had earlier, and some interesting ones in terms of when we were thinking of attributes, and we did have a few comments. One was a smile when entering the room. So your personality and making sure that people can see that, and, you know, because obviously being part of a team is usually a collection not only of different people but of different personalities as well, and how they interact. So
that's absolutely right. It reminds me of when I went for my first interview after I'd finished medical school, and I was tired. I'd gone to the interview, and the consultant, it was a consultant surgeon in Neville Hall Hospital in Abertawe, and he said to me, "What do you think I'm looking for in my house officer," which is what we call junior doctor then. "What do you think I'm looking for?" And I was tired. I wasn't particularly prepared, but I was very honest. And I said, "I think you're looking for somebody who knows their limitations, knows when to ask for help, and makes a damn good cup of coffee."
Yeah, that'll get you far every time. So yeah, so there were quite a few comments there on the sort of attributes. We do have some of the questions, and I'll just run through some of these now, and I'll take them in the order that they're appearing here. So what do you think will happen, and this relates to work experience, what do you think will happen with work experience because of COVID-19? Will the universities be more lenient, possibly, about people with little or no experience or less experience in the medical field, possibly as a result of, obviously, over the last 6 months or so, that, you know, any work experience in obviously any medical and care setting probably would be nigh on impossible. So do you think that'll be something that'll be taken into consideration?
Right, so I obviously wasn't clear enough. Work experience is not work experience insofar as following a consultant into a hospital or getting a part-time job in a care home. Work experience, if you were to mentor a younger child in your school, for example, if you have, and remember, COVID's only been the last sort of 6 or 8 months. Leading up before that, what were your hobbies and interests? What did you do? So I had one student who worked, he didn't work, he was the team captain on a basketball team. And his personal statement was about reflecting the importance of, just because he was captain, he had to know the strengths and weaknesses of his team, and he had to be able to support his team in what they needed to achieve. And so his reflection was all about that, and then also then how he would translate that into understanding that the role of the doctor is to be the team leader, but also to support the team. So it's not about work experience per se, it's about understanding the attributes and what you need in those environments. But absolutely nobody's expecting you to be able to get work experience. But understanding, saying, well, I went to this, where, you know, Dr. Heidi Phillips talked about getting into medicine. I've talked to GPs, I've talked to medical school students. One of the questions I will say that's quite useful is a number of students think, well, I want to be a doctor. I want to be a doctor. I've always wanted to be a doctor. And they say, okay, so by that, I'm hearing that you want to be a medical student. What happens after, once you've qualified and your first year and you are a doctor? What does that look like? Do you understand medical training? So it's not just I want to get into medicine and study a medicine degree, it's I want to become and understand what a doctor does. So the work experience now is, it's really far, far less important than actually doing things or having done things that you can then reflect on. But I will say there is a resource available. If you look on the RCGP, the Royal College of GP's website, there is a resource called Observe GP. And it is a fantastic resource of videos, real life scenarios of doctors talking to patients. And so if you don't get any chance of doing any kind of, you know, for the last 3 years of your life, you've sat in your bedroom and you've not actually interacted with anybody else, well, then maybe medicine isn't for you. But if all you do is look on Observe GP, and you can then reflect on what you think a good doctor is, what you understood by general practice, what you understand by the difference between general practice and specialising, things like that. Very long-winded answer, but yeah, I hope it's, don't worry about the work experience.
And just running through some of the questions, we've a question regarding, again, work experience. You know, is there a preferred way? What would be the best way to approach a hospital or GP surgery for work experience? Would it be direct? Well, obviously direct, or, you know, is there a is there a best way to, you know, whether it or not?
Yeah. So, for example, in South Wales, in Swansea, we've got Swansea Hospital, we've got Morriston Hospital, we've got Neath Port Talbot Hospital, and within those we've got undergraduate managers who manage the undergraduate curricula, if you like. So there's nothing stopping you ringing through to the hospital, through to the medical school, and saying, can you put me through to the undergraduate department? I'm interested in work experience. Or when you phone through to a switchboard, hello, I'm phoning, I'm interested in work experience. I would like to become a medical student and I'm interested in work experience. That's certainly the direct approach is, you know, as good as any other. I ran for the last 5 years a work experience scheme that puts students in touch with GPs to actually get that work experience, but we're not running it this year because of COVID. So I'm emphasize again, there's no expectation for work experience.
Is there a time that you would have to decide, or by when would you have to decide what field within medicine you want to specialise in? So,
well, guess what? I've only just moved into the field I'm in. So no, at interview, it's I don't know enough about them all. At this stage in time, I'm leaning towards this, or I don't know enough about any of them. I want to try them all, or I really love children. I didn't have a clue. And when I finished, I did an anaesthetics intercalated degree because I really loved physiology. I loved biology. I was rubbish at chemistry, but I really love biology, and physiology is like biology. So I thought, oh, I'll do this physiology. And anaesthetics is basically applied physiology. So I did that. And then I became an anaesthetist. The problem is I'm a talker, as you can tell, and my patients were all asleep. So I got a bit fed up and a bit sort of, I want to talk to awake people. And I'm nosy and I like chatting and I like conversation. And so general practice absolutely was fantastic from that perspective. You know, people are coming in, you're going, hi, I'm Heidi, come on in, have a few, what are we doing today? You know, and then I did that for 16, 17, no, more than that, 20 years. And with COVID, it changed general practice and I was facing being out of work. And so I went and worked within the ND team. So now I'm a doctor who helps diagnose children with ADHD. So that's the field I'm going into now. So, you know, you can change at various stages. You don't have to necessarily decide early on.
Great. Another quick one. If you get your medical degree in the UK, will that degree be transferable if you want to work in other countries?
Aha, Brexit. Up Forest.
Yeah.
I think I can get the chat up actually, David, too. Let's have a look. Our applicants who've taken 3 A-levels, I think it's A-levels rather than AS, rather than 4 at a disadvantage. No, absolutely not. 3 A-levels, 3 good A-levels. So I have 2 daughters, one took 3 and one took 4. And the one that took 3 was given an offer from a university, you need, I don't know, AAB. The one who took 4 was given an offer from a university, you need AAAB. Gee, thanks. She had a harder time and a tougher get in. So you need 3, check the medical school's website. Does a personal statement differ if you want to go into surgery or want to become a medic? No. If you really are passionate and you're absolutely sure you want to go into surgery, then you need to understand why, but you're not. You're applying to medical school. You're not applying to being a surgeon or being a doctor. So it's why going into doctoring in general. You didn't do as well as you'd have liked, but your teachers think you can go higher. Would the medical school still let you in, but your teachers think you could get? Now, that's a very interesting one. So I've talked to Dave Wilson, who's the admissions director for Cardiff University Medical School, and he recommends that there's no rush. If you haven't done well in your mocks and your GCSEs are a bit not as good as you'd like them to have been, time. Why not wait until you've actually got your A-levels and then apply with the A-levels you've actually got rather than the ones you got in your ASs? Because universities aren't really looking at your predicted, they're looking at what you've done. So if you're thinking you haven't done as well as you'd like, then take an extra year, get your A-level results, and then apply with your A-level results. Future options for studying medicine in North Wales. Yes, so there's the scheme that Cardiff Medical School are running, that if you apply to Cardiff and you're successful, you can actually enter the North Wales carer programme, so the North Wales medical school programme, where the majority of your medical school curriculum will be in North Wales. So that's one of your options. And your other option is you can apply to somewhere like Liverpool or Kiel, because some of your placements could then be in North Wales. By when do you have to decide? Well, I'm nearly 50 and I haven't decided yet. If you didn't get a high score in UCAT, do you recommend doing the BMAT and GAMSAT as well? Ooh, expensive. So what I would do is probably look at the medical schools that don't really use UCAT to base everything on. So Cardiff's an example. Cardiff UCAT's not the be all and end all for Cardiff. BMAT or GAMSAT, not both, because those medical schools that use BMAT aren't the same ones that use GAMSAT. So the GAMSAT is the graduate. So you won't be going in as a school leaver to a medical school that's using GAMSAT. That's if you're going in as a graduate. So if you don't do as well as you hoped you do, then you think, I haven't got into medicine yet. And then you can go and do another degree. Now, there are certain universities like Swansea that offer pathways to medicine degrees. So in other words, you could apply to Swansea University, you could do a number of our undergraduate courses like applied medical science or genetics or biomedical science or something like that. And then you get a sort of increased access, if you like, to then get into the medical pathway once you've finished your degree. So you get extra help and support, and it lowered entrance grades and things like that. So there are a number of universities that offer sort of help and support if you don't get into your medical degree, do a different degree and then go in that way. What I would say to that though is getting into medicine is quite competitive. When I was the admissions director, we had 1,000 applicants for 70 places. So it's a competitive field. So if you do an undergraduate degree, do it in something that you love, that you can imagine working in. Because if you're unsuccessful getting into medicine, then you want to be doing something that you'd love to do. So I had a student who he had got into law. He applied for medicine and was unsuccessful, so he got accepted into law, and he dropped me an email and he said, but should I be going for the applied medical science or the biomedical science? And my response to him was, well, why did you go for law? Because I want to help people. If you don't get into medicine, could you still help people doing the law? Yes, I could. Would you love it anyway? Yes, I would. Well, then there's your answer, because you're going to be spending a fair amount of your time doing it.
There's just one question that's coming here. If you have chosen A-levels that don't suit medicine and then you decide you want to study medicine, are there any other pathways in? So... Yes.
So that's what Swansea was set up to do. So our fantastic medical school here in Swansea, you can do whatever you like. You've chosen your A-levels, you've decided, oh, I don't know, you want to do what, art, design, tech, and maths, say. No chemistry, no biology, nothing, but you've done really, really well, and you go off and you do another degree. And then with that degree, as long as you get a 2-1, or if you get a 2-2, you go on and do a master's and get a master's degree, so it's usually a 2-1, you can then apply for graduate schools with your degree. So you don't need to go back and do A-levels, you can carry on and then go into graduate entry medicine rather than undergraduate medicine. So undergraduate medicine is where you go from school, 5 years. Graduate medicine is where you go from having done a degree, 4 years.
Brilliant. I've got, maybe we just do a couple more questions before we wrap up. If you take a gap year, do you have to justify it in your interview? If your gap year wasn't medically focused, does that put you at a disadvantage?
No, but it's all about reflection. What did you do in your gap year? So I've already said I've got 4 children. My son spends his entire time in his bedroom on Minecraft. He's going to really struggle in an interview selling what he learnt in Minecraft. My daughter was contemplating a year out because, you know, COVID and just not sure what she wants to do, and thought, well, what are my options on a year out? Because I can't travel the world anymore. I can't go and work in another country anymore. So what am I going to do? So you do need to think very carefully about what you're going to do, but it's less important about what you do, but then what you learn from it, what it taught you about yourself. And no, it doesn't need to be in a medical related thing, but if you are taking a year out, then medical related work experience for a whole year is a really good idea. So working as a porter in a hospital, or working as a healthcare support worker in a nursing home, or something like that, you know, it's valuable. It's valuable time, and it's not, as I said before, it's not about what you do. It's about what you learned about yourself and humanity from doing it.
I'll just do a couple of quick ones. Do universities accept UCAT resit? So if you have to, so.
And GAMSAT resit. Yep. I have a medical student who took GAMSAT 6 times.
Right. So I think that's a definite yes then. So,
A
and
definite yes, because one of the things we look for is resilience, bounce back ability, determination, passion. You can't get somebody more determined than somebody who's flipping resitting all the time.
Yeah. And I'm just going to have this one as the last one. How strenuous is the workload when it comes to a medicine degree at university?
Oh, my love. Right. So I'll compare an English degree, which was 9 hours contact time, with a medical degree, which was 37.5 hours contact time. So if you want an easy ride, don't go for medicine. You're on the wrong webinar, to be honest. If you're thinking that this is hard. It's hard work. It's hard work, and it's a lot of years of getting there, because just when you finish your 5 years medical school, you've still got to then do your medical training. So that's when you've become a doctor, but then you've got to undergo 2 years of core medical training. Then you've got to do either specialist medical training or GP medical training. So it's a long process. So actually in university, it's strenuous. It's a lot of hours. It's a lot of work.
Heidi, I can only thank you for your time and your expertise and your fabulous tips. And I'm sure everybody who's been listening in will take a lot. Everybody will take something different, but I'm sure, especially going back, and again, it's that R word again. Well, there's two R words I've seen is reflecting, and the other one is resilience. So, you know, and I think, you know, I think it's been really useful, and we're really thankful for your time, because I know you're really busy. So it's really great to hear from you. Just in terms of sharing, I know Heidi mentioned earlier about those personal statements that can be shared. So I will share those with people who have been able to join us today, and if there are any other useful bits of information, we will share those with you as well. Maybe some bits of the presentation where there are email addresses or web addresses that people can really benefit from. So again, thanks very much. Diolch yn fawr. The Welsh was excellent at the beginning, so well done there. Diolch yn fawr iawn. And thanks to everybody who's been able to join us today. As I said, I hope you found it valuable and hope you take something useful away from today. Thanks very much. Diolch, hwyl fawr. Bye.
Bye-bye.